Good Thursday afternoon. I'm Dr. Martha Buchanan, Senior Director and Health Officer here at the Knox County Health Department. Our moment of gratitude is more a moment of reflection for those who have been or are currently battling breast cancer. October is National Breast Cancer Awareness Month, and we encourage everyone to take this opportunity to learn more about how you can take steps to protect yourself by getting regular screenings and having conversations with loved ones. You can also wear pink this month to help raise awareness. Our thoughts are with those who are currently battling this disease as well as their loved ones. Now we'll move on to the local situation. We have 76 new confirmed cases since yesterday, giving us 11,310 confirmed cases of COVID since March. Additionally, we have 531 probable cases. 10,556 of our cases are considered inactive, giving us 1,195 active cases. 407 individuals have been hospitalized at some point in their illness. 57 Knox County residents are currently hospitalized. And fortunately, we have no deaths to report today, keeping our total at 90. Now we'll transition to the benchmarks. As a reminder, all of this data that we are going to talk about is on our website. You can find it at covid.knoxcountytn.gov/case-count. Moving to our first benchmark, sustained reduction or stability in new cases for 14 days. To illustrate this benchmark, we have our bar graph that shows previous cases, new cases, and the growth rate over time. Over this time period, the last 8 days were flagged yellow or red. The first 4 days presented with yellow flags, followed by 4 red flags. This indicates a continued increase in cases and is why we are representing this benchmark as red. Our second benchmark, community-wide sustained and increased diagnostic testing with consistent or decreased test result reporting turnaround time. For this benchmark, we are utilizing 2 bar graphs. One that shows a sample of the tests conducted for Knox County residents, and another for the average time between specimen collection and lab report. Over the 14-day evaluation period, 4 consecutive red flags were noted for lab lag time. Over the past 2 weeks, lab turnaround time is averaging around 2.5 days. Regarding testing, we did have 3 red flags, but not on consecutive days. Because of those factors, we are continuing to represent this benchmark as yellow. You will notice the numbers on the tests conducted chart have increased. That's because we are now using Tennessee Department of Health data, which is comprised only of PCR tests, to calculate testing volume in Knox County. This was done to better coincide with the new positivity rate chart added to the website. Lag times will still be calculated using a sample data from Knox County. Our third benchmark, sustained or increased public health capability. For this benchmark, we aim to initiate investigations for new cases within 24 hours and close contacts within 48 hours. With our current EPI support team, we continue to be able to initiate investigations in this desired timeframe. Because of this, our benchmark continues to be represented as green. I do want to take a minute to say that in order for this process to work and for us to do our job to protect the community, we need individuals and businesses to cooperate with our case investigators and our contact tracers. We continue to encourage everyone who receives a call from us to work with our team to provide the necessary information to help keep our community safe. And just to note, we keep that information safe as well. As you know, we do not divulge information on cases or contacts. And so the information is kept safe and used only for the purpose of protecting our community and public health investigation. Our fourth benchmark, healthcare system capabilities remain within current and forecasted surge capacity. These graphs show the availability of regional hospital beds, ICU beds, and ventilators from our hospital partners. It also shows the additional surge capacity for these categories, as well as the COVID positive patients and patients with pending test results in the hospital. These data are gathered from the information hospitals put into the Tennessee Healthcare Resource Tracking System, or HERTS. It may reflect Knox County, the East Region, or patients from other jurisdictions. During the past 14 days, we have noted a continuous upward trend in hospitalized COVID-19 patients. Additionally, over the last 8 days, we have noticed consecutive red flags for ICU hospitalizations in patients requiring ventilation. Both of these metrics reflect a continuous upward trend. These flags are based on our published metrics that illustrate statistically significant shifts in the data. After speaking with our hospital partners, they have recommended that the benchmark remain yellow because they are currently below surge capacity and have adequate staffing capabilities for the current number of inpatients. However, they would like us to stress, and we agree, that our community members should pay close attention to this metric and take it very seriously. These are the highest numbers that our region has seen since the pandemic began, and we are on the cusp of flu season, when hospitalizations typically increase. Everyone needs to practice the 5 core actions and get a flu shot to ensure our hospitals aren't overburdened. As always, the hospital systems continue to meet routinely, work together to ensure that no system is impacted disproportionately, and plan the response together to best serve this community. The decisions regarding how to classify this benchmark are made in concert with our hospital partners, as well as taking all of the data into consideration. Our 5th benchmark: sustained or decreased COVID-19 related death rate for identified positives and probable cases. For this benchmark, we use a graph that shows the reported deaths of Knox County residents by the date of death. Over the past 2 weeks, we have seen 6 deaths, with 4 in the last 7 days. This information leads us to represent this benchmark as green. However, this is a cautious green because we anticipate this number to increase with a growing number of hospitalizations. Under our supplemental data section, the first chart shows our daily COVID cases per 100,000 population. As of yesterday, our 7-day trend line shows 23 cases per 100,000, and our 14-day trend line shows 20 cases per 100,000. The second chart shows the percent positive of COVID-19. This data is received from the Tennessee Department of Health. Our positivity rate is starting to trend back up, and the 7-day average is 9.76. Both of these charts we published weekly on Wednesdays, and now I'll open it up for questions.
All right, go ahead and submit your questions into the chat feature. Get started. Let's see. Looks like to be a couple questions from Malik with WBIR about the flu, and I'm going to pass that to you because that's got updated numbers that could help you.
Okay, thank you. Great.
Let's see. The first question, there's several here, so I'm going to break them up one at a time. From Malik with WBIR, are there flu cases in Knox County yet?
Flu is interesting because flu is not reportable to public health. Flu deaths in pediatric deaths and pregnant deaths are reportable to public health. So I think I did see a report from the Tennessee Department of Health where they sent out their influenza-like illness report, and actually influenza-like illness, which is a measure of flu activity in the whole state and in our community, was down just a little bit. So we haven't seen a lot of uptick in influenza-like illness in our community at this time, but we'll keep you posted on that.
Malik's next question is, how many flu shots has the Knox County Health Department given out thus far, and is that number higher or lower than in previous years?
So as of now, we've given over 1,600 flu vaccines. That's in our clinics and in our community outreach that we're doing. So last year, by this time, we'd given out. So, and last year at this time, we'd given 269 vaccines. However, we got flu vaccine much earlier than we normally do and started giving it earlier than we normally do. That was something that the CDC and asked the manufacturers to get flu vaccine out earlier so we could start vaccinating people to reduce the risk that we have a bad flu season in the United States.
Malik's next question is, how does the flu shot work? And can the flu shot give you the flu? Why or why not?
So there are two kinds of flu shots. One is an injectable kind of flu shot, and it's a killed virus, and it cannot at all. Actually, none of them can give you the flu. So it's a killed flu virus, and it contains 4 different strains of the flu virus, and it works by injecting this dead virus protein into you so that your immune system sees the protein, reacts to the protein, and is ready to fight the flu if you get presented with it. So it prepares your immune system to be able to defend you against the flu if you get exposed. That's how they all work. And it can't give you the flu, but you know what it can do? It can make you feel a little bit achy. It might make you have some soreness where it was given. It might make you even have a low-grade fever. Those are all normal things. That's your immune system doing its job, creating antibodies, so that then if you get exposed to the flu, you are less likely to get the flu. And if you do get the flu, it'll be a much milder case. So get your flu shot. The other kind of flu shot we have is the nasal spray that we've used for years in schools. It's called an attenuated virus. So it's an altered virus that cannot give you the flu. And it acts in the same way by presenting flu virus protein to your system. So your system reacts to that and creates antibodies to it. But it's designed to change so it can't reproduce in your lungs where you get flu infection. So it can't give you the flu. Again, all of them can make you a little bit achy, make you feel a little drowsy or run down for a couple of days, but that's your immune system doing its job. When I used to get flu mist, my nose itched for 2 days after I got it every time.
Malik's next question is there a special senior flu shot?
There is a special senior flu shot. It's called high dose flu vaccine. It's recommended for people 65 and over. And it was developed because older folks don't mount the robust immune response that younger people do. And as we age, that decreases. So this high dose shot, kind of gives the immune system a little bit of a boost and makes you mount a better response to the flu vaccine. So your protection is better.
Malik's next question is, why do young children / babies have to get their initial flu shot twice?
So the first time we get a flu shot, it kind of activates our immune system, but not fully. So we give them that second dose to give them that booster so they're fully protected for that year. And we only have to do that once in our lifetime, the first time you get a flu shot. And that reminds me, the new COVID vaccine, whenever we have that, will probably be a 2-dose as well for the same reason for kids and adults.
Another question from Malik is, how are you preparing for flu season amid the pandemic?
Well, our hospitals are preparing, and what we're doing is encouraging all of you to get your flu shots and giving flu shots, because that's the best way we can prepare for the flu. And honestly, continue to practice the 5 core actions, because we know that will reduce the flu as well.
Another question from Malik, what is something people should know about the flu shot that maybe they don't already know?
Wow, that's a great question. I don't know what people don't know. That's a challenge for me. I think the message I want everybody to hear is the flu shot is a very safe, effective way to reduce your risk of a disease that can be serious for some folks. So, and one thing I think one of the myths, take this opportunity to bust some myths. One of the myths that's out there is you can get your flu shot too early. That's not true. Your immune system's pretty amazing. And if you get your flu shot now, you'll be protected for the whole flu season because your immune system has memory, and it has to take a minute. And it says, oh yeah, I've seen that before. And that vaccine we got several months ago, and it can still fight against the flu. So don't wait. Get your flu shot now. You should get it as soon as it's available. They're available widely throughout the community. We're not the only ones giving flu shots. I think that's important for people to know. It's available at lots of pharmacies, lots of doctors' offices, widely available. If you have an opportunity, if you're in Walgreens and you need to get something, or Target or whatever, swing on by and get a flu shot if you have time.
Another question from Malik with WBIR. How close to capacity do hospitals run during flu season? Is there concern hospitals will fill up with COVID-19 and flu patients?
Well, obviously, there's concern about hospitals having more patients than they can accommodate. But how close they run to capacity is a great question for them. We don't track those numbers, and they know more about their capacity than we do.
And another question from Malik, how much credence do you all give to the idea that the flu season won't be as bad because of mask wearing, social distancing, and people using better hygiene?
That's a great question. And, we'll have to wait and see. But again, practice back to the 5 core actions, and we might see a different type of flu season than we normally see.
From Claire with WUOT, did the Knox County Health Department receive a copy of the White House Coronavirus Task Force report issued to the Tennessee Department of Health on October 11th?
Oh, okay. I'm being told I think so. There's a lot of specificity in that question. So yes, the Tennessee, the state of Tennessee, the Department of Health is sending us what they're calling the governor's report specific to Tennessee. It's not the whole White House report. That was shared with the Board of Health.
From Jeff with WATE, with hospitalizations up and positivity trending up, do you believe Knox County's COVID-19 situation is worse than it was 2 weeks ago, last month?
Obviously, we're concerned. We have more cases in our community. We probably have more cases than we're even seeing in our community because positivity is up, but testing volumes down and hospitalizations are up. So what that tells us is that the burden of disease in our community is probably higher than it's ever been during this whole pandemic because people are worried about getting tested. They don't want to be isolated. They don't want their friends to have to be quarantined. And I get it. Being isolated and quarantined is no fun whatsoever. But giving COVID-19 to your friend who has diabetes or your grandmother or your older friend or whatever, who then ends up in the hospital is no fun either. So it's important to know if you have the disease. It's important for people to get tested and observe isolation and cooperate with quarantine. That's how we as a community are going to be able to stay where we are and not have further restrictions on what we can do.
From Vincent with the Sentinel, do you have the PCR protocols used by your lab partners, and which PCR protocol is KCHD or the Tennessee Department of Health using? And he says when he says partners, he's referring to Path Group.
Yeah, we're using several different labs, and that's a great question for labs about their protocols. We have their information and how they want us to collect the specimen. That's what we have.
Also from Vincent with the Sentinel, can you please explain how PCR works and when a positive is registered?
So PCR is called polymerase chain reaction is what that stands for. And it's looking for viral DNA. So they put it into a very sophisticated system that then separates the non-viral DNA and the viral DNA. And they they do a cycle threshold process, I forgot the word, that then enables them to see the viral DNA very clearly that's there. PCR cannot produce viral DNA if it's not there. It can't detect viral DNA if it's not there. It only detects viral DNA that is there. And the PCR we're using for COVID-19 is very specific to COVID-19. We use PCR testing for lots of other things, honestly, including influenza. It's a very common test used. And cycle threshold and amplification are commonly used because virus particles are very small and they're small. It takes a small amount of virus to make somebody sick, and amplifying that to be able to see it is a common practice for lots of other illnesses, not just COVID. This isn't new for COVID. And a lab is probably a better resource for the details of how they run that. And PCR is considered the gold standard for COVID testing. And other testing too, but COVID is specifically.
From Jeff with WATE, if needed for surge capacity purposes, would it still be possible to return to those plans for an alternate care site at the Expo Center or some other facility? Are we still able to resurrect that plan or something like it?
So we still have a committee that's meeting to talk about the potential for an alternate care site, I believe. Establishing an alternate care site is something we have to do in coordination with the Tennessee Department of Health. So those decisions will have to be made not just at the local level, but also at the state level.
All right, any other questions? Please go ahead and submit them now. All right, not seeing any other questions come in. So thank you all for your time, and we will see you again next week. Have a good and safe weekend.